The next presenter we have is Susan Young from the Alliance for Equitable Healthcare. Thank you, Susan, for presenting on exploring the viability of a public hospital district.
Thank you so much for inviting us this morning to be here with you. I'm Susan Young from the Alliance for Equitable Healthcare, and this is Jeff Coughlin, who is also with the Alliance. I can't think of a more perfect lead-in than the presentation that you just had. Actually, this is a follow-up to an email that I sent to all the members of the Health Board in March, shortly after the Johns Hopkins report was released. And I want to take just a moment to remind you of who the Alliance is and what we do. Our mission as a nonprofit, which has just applied for 501c4 status, is to work collaboratively to increase access to affordable, equitable, and comprehensive health care to every resident of our county. We're a grassroots group originally that formed in December of 2021. We have membership that is made up of community leaders, of concerned residents, and we have been meeting monthly since that first meeting in 2021. We have formed working groups that have taken on the role of exploring various possible strategies or solutions to some of the healthcare issues that we all are aware we're facing here in the county. We have recently, well, actually not recently, since October of 2022, when members of the community started raising the question about what about a public hospital district or a PhD? Is that something that we could do here in Kitsap? And if so, what might that look like? And we've been looking at that since then. And we have developed some materials in your packet. You'll see this on the last page. It's a sky-high overview of what a public hospital district is, and then there's some FAQs on the back that serve as an introductory overview to the whole idea. We have plenty of data that we have access to, identifying what our issues are, what resources we have, what our gaps are, where we need to look and start our work. This particular slide comes from the 2023 Community Health Needs Assessment that was published by Virginia Mason Franciscan Health, talking specifically about St. Michael Medical Center. And in that report, they include a chart that identifies 5 prioritized areas of significant need that we need to be looking at and dealing with as a community. And I don't think there's anything on that list that is a surprise to anybody. It's things we've been talking about for a very long time. Then, thank you. In December of last year, the county health department came out with its community health assessment. And in January of this year, 3 priority areas for the next 5 years were identified by a group of more than 70 representatives of various organizations throughout the county. And on the slide, you see the 3 areas that were identified there. And there's all crossover between what was identified as being an issue in the China report from Virginia Mason Franciscan Health and this report from the county. Then in March of this year, a report that was actually commissioned by the board here and conducted by Johns Hopkins University came out with a number of recommendations that identify issues that we have, gaps that currently exist in healthcare. But with this list of 5 items, which again, they're things that showed up on the previous 2 lists, these were areas that were identified by the researchers as places we could get started now. That within this year, we could actually start making a difference with these. However, as you all were just talking about, and as we have learned in talking, we've been interviewing a variety of healthcare leaders since last summer, doing listening interviews, asking them what they think, not what we think. And when we've asked about what are the impediments to doing what we know needs to be done, things are mentioned like workforce issues, other common things that you hear brought up. But two things that came up consistently in virtually every interview we've had so far have been lack of access to sustainable funding and a need for a coordinated county-wide approach to healthcare. Not things being done by one organization, but rather things being done in unison and in collaboration and cooperation, and leveraging the strengths of each of the different agencies that are providing healthcare. So according to the people we've talked to, if we could stop chasing dollars all the time, and if we could figure out how to work together more efficiently, we might be able to start tackling some of these needs.
Thanks, Susan. So many of our members were at the March 5th meeting of the Kitsap Public Health Board when the report from Johns Hopkins was issued. Again, it's been about a year since it was commissioned, and our ears certainly perked up when we saw one of these top recommendations, which was to launch a formal commission to explore the feasibility of forming a public hospital district in Kitsap. It's something we've been looking into. So here to say, what is a public hospital district? So essentially, as you see up there is a full definition, but it's a community-created governmental entity that's authorized to deliver health services. There's actually 56 of them in the state of Washington, so that's more public hospital districts than we have counties. And despite the name, they're authorized not just to create or operate a hospital, but to deliver any type of health service to help people stay healthy, physical, social, mental. And about 1/4 of the current public hospital districts in the state don't operate or build a hospital. They offer other services. And because they're owned locally by citizens, they tailor their services to meet the needs of the community. So we have some examples in the packet that you can see, but I wanted to say a couple out loud. One is Kennewick, city of 85,000. They have a public hospital district that is called Two Rivers Health District. It offers a couple health services, but includes substance abuse treatment. And Snohomish County actually has 3 different public hospital districts. The first one does operate a hospital, but number 2 and number 3 don't. Number 2 is called Verdant Health Commission. It funds food security in schools, low-income dental needs, paramedicine programs, mental health. And number 3 is exclusively focused on substance abuse and mental health. So there's a lot of great examples of public hospital districts, not just operating hospitals. It can provide direct services, but it's really a funding mechanism as well. So we began exploring this, as Susan mentioned, about 2 years ago, and we've learned that, this isn't a panacea, it's not a cure-all for every healthcare issue we face, but it certainly can go a really long ways towards addressing some of our critically needed shortages. So how do you create one? Well, there's a whole RCW that outlines it, but in short, it's just a simple majority election. It can either be put on the ballot by petition or a majority of the county commissioners. It goes to the ballot, a simple 50% vote. Once it's created, there's then a separate election to elect commissioners. So these, typically there's about 5 for public hospital districts. The number can vary, but it's just like our fire districts, our ports. It's a board of commissioners that oversees it. And so just like any other agency, there is government transparency and accountability built into the process, and it's governed by the citizens. And how is it supported? It can get funding through a couple different mechanisms. The main way is through property taxes. So legally, the rate can range from 25 cents to 75 cents per thousand assessed values, but most PhDs assess in the low end of about 35 to 40 cents. And so noting that in Kitsap, if it was created at 35 cents per thousand assessed value, that'd be over 22 million annually in property tax that could go towards these critical healthcare needs.
And that's why we're pushing so strongly for a county-wide public hospital district. If everyone was involved, we would be able to lower costs for every property owner, but raise a substantial amount of money that could make a significant difference in sustaining different programs, not simply patchwork kinds of solutions. Okay, forming a public hospital district is way more complicated than what Jeff and I just described to you. There's a lot of work that needs to be done to make sure, first, that it's feasible for the county, and second, then, to go through the process of putting it on the ballot, finding commissioners or people who would be willing to run for commission, having that also be included on the same ballot, and then going through all the mechanisms of meeting all the RCWs to make sure that we do it the right way, because there is a process in place. This is not something we would make up. And before we do even any of that, what we need to do this summer is we need to start looking at how do we measure the feasibility? How do we see whether or not this is something we actually could do here? And there are a few things listed on the slide that are steps that need to be taken. But, and the Alliance actually is working at this point in time on putting together a public education program for this summer, as well as looking at how we might be able to start surveying the community in terms of interest and willingness to go ahead and put something like this forth. But it's not something we can do by ourselves, and it's not something that the report from Johns Hopkins recommended any one agency do by themselves. They went back to that three-legged stool metaphor and suggested that it needs to be you, it needs to be the county commissioners, and it needs to be a group of stakeholders from the community, which we can offer up, certainly at least a good part of it. And so what we're here today to say to you all is that we believe that a public hospital district could go a long way toward rationalizing how healthcare is supported financially in this community and how it addresses the needs of this community. But we need your help to make that happen. And it needs to happen now. It needs to happen this summer. If we were to get this on a ballot, the soonest we could do it now would be November of 2025. And it's not hyperbole to say people's lives depend on what we decide to do with the healthcare situation in this county. And we have an opportunity now to do something about that. If you have any questions.
Thank you so much. I see many, many questions, so we're going to move to them. I'm going to take the prerogative of the chair, though, and ask the first one. My question is about fairness. And so, we know that there are many entities in Kitsap County that should be providing the type of care that they don't. And now we have these gaps, right? DOD should be supporting more prenatal care, right? We should see those types of things. We also see that there are a mix of profitable and less profitable things that should be offered by maybe larger healthcare organizations in our county. And so if our public hospital district takes on these low profit needs, do we then just absolve the sort of requirement that we should be having for other entities that should be taking those responsibilities and moving it to the taxpayer?
Oh, no, absolutely not. I think part of the whole idea of a public hospital district is it's a community endeavor, and that doesn't let anybody off the hook. That doesn't let the Department of Defense off the hook, doesn't let for-profit providers off the hook. We need to work together. The commission develops a plan in collaboration with appropriate agencies throughout the county, and it needs to be something we all do together.
Okay, I saw Dr.
Just to jump in real quick, because the public hospital district commissioners are, elected by people, it's yet another voice folks have to hopefully collaborate with the entities like the Navy you mentioned, but also a strong voice when needed to stand up to them.
Dr. Watson and then Mayor Erickson.
Thank you very much. What services throughout your conversations have you determined could be or should be provided by the public hospital district, and who will provide those services?
We've asked in our listening interviews that I had referenced earlier, we've asked people, what do you think the most important priorities should be in the county? And for the most part, it's probably no surprise that what's been brought up is general access to health care, mental, behavioral health, substance abuse, OBGYN, reproductive care. Those are the areas that have come up. The commissioners, when they're elected, would sit down with all the data, and they would then make their decisions about which of the community needs are targeted first. Who provides those services? We have a lot of providers in the community who, with more resources, would be able to expand perhaps, or to enhance what it is they're already providing. We have a hospital. We have a medical center. We have mental health providers. We have people who are doing a variety of different things, and those are people who all could then contract with the public hospital district in order to provide services, but we could also contract with new providers.
One follow-up question. I would disagree with the assertion that we have enough people to provide services and that they are not doing so now simply because they don't have the resources. I would challenge you to demonstrate to me physicians or clinicians in the community who aren't working at capacity right now to try to provide those services. So I'm just curious, more money is great, but we don't have enough people, human capital, to provide the service.
I'm sorry, I think you misunderstood what I said.
I must have.
You definitely did. That is not what I said.
Okay.
And not what I meant to say at all.
Okay.
Okay. No, the people who are here are doing their level best, and I would never say that they weren't. But what this is also possible is dollars from the public hospital district could be, should the commission make that decision, could be used to support the training programs at OC. They could be used in, on Orcas Island, for example, they're used to provide housing for employees so that they'll come be on the island. They can be used for anything related to health care. And so if bringing in additional staff is what the commission decides is needed in collaboration with providers, then that's what they could do.
Okay, so we have Mayor Erickson, and then I want to just check if anyone else has a question, because we do need to move to executive session very quickly. So I think Mayor Erickson will be the last to ask a question, and then we'll just have a quick answer.
I want to thank you for your energies and efforts towards this. My concern is the structure of the vote. And traditionally, South Kitsap County doesn't even pass school initiatives. And so I'm concerned, yeah, these mics aren't good. I'm concerned about the structure of the organization. Traditionally, South Kitsap doesn't pass school levies. And so if you go countywide, and Susan, I've told you this before, you do all the energy and effort to go countywide, what happens is you won't have the votes, especially votes that, I think you need 60% for any bonding capability. No, is it still 50?
It's
60.
50,
I think
yeah. It's 50 plus one for this, for a special district.
60% for any kind of debt service, okay, which means that you are literally going to be only funding services and no capital. So I've encouraged you before to limit the size of the district to those people that would normally vote for such a thing. And I think that you're going to have much better success at that. And, you know, that the realities of our political world are important when you're putting an initiative forward. The worst thing you can do is put it forward and have it fail. If you really want success, you need to recognize what your voter base is.
I understand that, and that's one reason why this summer we need to do the work of community education, of community polling, and find out. I mean, if it turned out that there's absolutely no way the people of South Kitsap would support this, then that would be something we would need to talk about and we would need to consider, and it's why we need to do it now. But the other thing I want to point out is that if we carve the district up, then first off, we have to collect signatures to get it on the ballot. Second, if we say we create a district that begins with Central and North Kitsap, there's nothing to stop people from South Kitsap not contributing financially to the district, but coming and being served in any facilities that are part of the PhD. So,
Totally aware of that.
Yeah.
I just don't want to have this organization and all the people, because I think this is vitally important, what you're talking about, to go through it and have it fail. I understand that South Kitsap people, if they weren't included, would use the services. I'm okay with that, if in fact we're successful at putting together a district.
but that's why we have to start this summer. That's why we have to talk to people. We need to figure out what is realistic.
Thanks so much. Really brief comment from Commissioner Rolfes.
Yeah, this is for our team, not a question for you all. It seems to me logically the next step in this is to do some kind of community polling where you get a poll out and find out what are people's perceptions of the problem and what's their willingness to pay. And so my question is, can a government entity, like can the public health district do a poll, or does it have to be a political party or a nonprofit? And so I don't know that we can answer that now, but could we get that answer? Because I don't know that we can move forward until we have a chance to test how this bounces off the rest of the community. Can you ask your lawyer?
Mayor Wheeler, did you have something very quickly?
Yeah, I was going to say on top of what Commissioner Rolfes said, we have recent public outreach, pretty extensive with community needs assessments. Public Health District has done one, Kitsap Community Resources. So I think we could lean heavily on what we've heard. And so then it's just a matter of what is the critical shortage and the gap that, and identifying what is that one gap that cannot be filled with what we have currently. And obviously the political analysis needs to happen. Who will vote in what district for what, but if we can meet that critical gap, I think we can get a county, I believe the county could support it, as long as we can prove that this initiative could fill that. And so we'd have to do that. And I don't know who does that type of work. That's a heavy lift. And so I'm looking at our staff and their eyes are rolling. Because we all want to do something. That's why we're here. And Dr. Kirk Sells, maybe that'll be a conversation that you can have as the chair with our staff and administration, kind of following up. And
Yeah, some answers to be gotten in the interim month here. But for now, we're going to move to a close. Thank you so much for your presentation. We really appreciate it, and a lot for us to think about. We'll now move to